You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are talking with ONS member Mary Elizabeth Davis, Clinical Nurse Specialist at Memorial Sloan Kettering Cancer Center in New York, New York, and member of the New York City ONS chapter, about the latest nursing management and prevention strategies for increased intracranial pressure. This episode is part of a series about oncologic emergencies. The previous episodes are linked in the episode notes. You can also earn free NCPD contact hours by completing the evaluation we've linked in the episode notes. Thanks for joining me today, Mary Elizabeth.
Thank you for having me.
So to start us off, can you give us some background on increased intracranial pressure in patients with cancer?
Sure. So once we reach the age of about 18 months and those fontanelles on the skull fuse together, the area inside the cranium or inside the skull really has limited space. Usually within the skull, there's about 80% of your brain takes up about 80% of the tissue in there. There's about 10% of circulating cerebral spinal fluid and about 10% of blood that goes through the blood vessels. What happens when you have increased intracranial pressure is either the volume of the brain increases, such as people that develop a brain tumor or a brain abscess or infection. If the volume of the cerebral spinal fluid increases, and that can happen if you have a condition that you have increased production of cerebral spinal fluid, or if for some reason the cerebral spinal fluid is obstructed and unable to leave the cranium. And finally, you can have increased intracranial pressure if the volume of blood inside the brain, if you have increased cerebral blood flow. You might also hear the term intracranial hypertension, and that essentially is the same thing as increased intracranial pressure.
Okay. What are some of the possible complications of increased intracranial pressure in patients with cancer?
I think it's important to remember that increased intracranial pressure is a life-threatening condition. What we worry about most is something called herniation. And this happens when the brain shifts inside the skull. And there are several different types of herniation, depend on which sort of direction the brain goes. But one of the worst and what we worry about usually the most is when the brain shifts downward, because what happens is it can shift down on the brain stem. And of course, the brain stem is where all your vital functions are for breathing and circulation, and it can cause death. There's something called Cushing's triad, and that's a clinical syndrome that happens. That's an impending sign of herniation that we really, really worry about, which is high blood pressure, really high blood pressure, low heart rate, and an irregular respiration rate. And that is all indicative of pressure on the brainstem. So herniation is probably the most things we worry about, besides the signs and symptoms that patients report.
So are there certain populations of patients with cancer that would be at a higher risk for developing increased intracranial pressure?
Yes, certainly patients that have primary brain or spinal fluids, those areas, again, causing that pressure inside the skull. Even those that have cancer elsewhere that have metastatic brain tumors can also increase the brain volume inside the brain. We also carefully watch patients with leukemia or anybody who has the potential for thrombocytopenia or platelet dysfunction, because bleeding in the brain can sort of cause the same symptoms as a tumor would.
And then let's talk a little bit about, are there certain cancer etiologies that can lead to increased intracranial pressure?
Well, as I sort of mentioned, we also not only, I think everybody thinks of a primary brain tumor causing pressure in the brain, but we do need to think about those diagnoses that frequently develop those brain metastases, very common in lung cancer, breast cancer, and melanoma. So those patients who might present with some of the signs and symptoms I think we'll go over in a little bit, you would want to think about increased intracranial pressure.
I think it's really important for our listeners to understand and hear, especially what you just said. There's so many things that the nurse has to think about when they're taking care of their patients, their diagnosis, the treatment they're getting, the side effects, maybe the family dynamics that are going on, so many things, but really that there are even more. And specifically when you're talking about some of these oncologic emergencies, being able to understand and identify who some of those patients are that would be at risk.
Yes.
So, what is the diagnostic process for a patient with cancer who has a suspected increased intracranial pressure?
So I would back up just a little and say that when we were talking about other diagnoses, I think what should come to mind for a nurse first and foremost is patients complaining of headache. Headache complaints should be taken seriously. And when we're talking about sort of recognizing those are at risk, keeping in mind those diagnoses as well as brain tumors is important. And we'll talk a little bit about the signs and symptoms earlier, but headache is really kind of going to be your stop sign to say what's going on here. And what you would do is if you are worried about increased intracranial pressure in somebody with cancer diagnoses, the quickest, relatively inexpensive test to do is a CAT scan. And we do them very quickly. They can be done, with or without contrast. But they really want to check for bleeding in the brain or tumors in the brain. And if you suspected some type of a vascular issue, you could do an MRI or an MRA, which is the MRI with angiography.
Okay, you mentioned, the nursing assessment and that paying attention to patients complaining of headache is kind of your first sign that you want to be aware of and watch out for. So, what nursing assessment should be performed for patients that you are suspecting may have increased intracranial pressure?
Well, certainly, as we mentioned, the headache and just some qualifiers for the headache. It's not just your average sort of migraine headache. I would be especially concerned if the headache is worse in the morning. What happens is when you're sleeping at night, the fluid and the blood kind of stabilizes in the head. So patients that have a headache worse in the morning, that sort of gets better during the day. The other thing is listening to what the patient is, how they're describing their headache. If it's full or throbbing, sometimes they can use the word bursting. And most especially if it's exacerbated by bending over or coughing and sneezing. And all of that, as you can imagine, is related to fluid shifting in the brain. So the headache, again, I'm emphasizing that. But the other things to look for as a nurse is, and again, bringing the family into this, because sometimes this might be happening at home. And then the nurse is either triaging or having them come in or triaging over the phone. So changes in mental status, somebody who was mentally sort of fine and now is getting a little disoriented or confused. You can have changes in respiration, changes in your pupils, and certainly stroke-like symptoms like weakness on one side of the body, any type of seizure activities, and sometimes you can even see nausea and vomiting. And what I think is hard is some of these signs that and symptoms that we're talking about, it can be from somebody who's undergoing cancer treatment. So sort of trying to put the whole picture together is really important. As the intracranial pressure rises, though, you will definitely see the condition worse, and really changes in level of consciousness. The patient can then become, unarousable and comatose, and then you'll definitely see sort of changes in patterns of respirations, the blood pressure and temperature changes, and then we really worry about the patient. It's a neurologic emergency if they start showing signs and symptoms of posturing or some loss of stem cell reflexes, pupillary changes. So again, the idea of assessing it early and sort of catching it early so you can do something to prevent them from getting their conditioning worsening.
Okay. Like you said, some of those signs are things that a nurse might see, normally with the early signs with a patient who is receiving treatment for cancer. So it's so important to kind of be able to put all of those pieces together. So what treatment interventions are used to manage increased intracranial pressure? And are there specific nursing considerations for those interventions?
Well, I mean, I mentioned before about sort of the telephone triage or bringing them in, but at this point, if anybody's concerned about increased intracranial pressure, they should be in an institution in a monitored situation, with the diagnostic tests that we talk about. One of the easiest and probably least technological things we can do is position the patient properly. So we usually elevate the head of the bed, but only to about 30 degrees. Don't want them sitting up straight, but you also don't want them lying flat. And that's really just to help the venous drainage, the cerebral drainage come down. We want the face to be, particularly if you can, midline. You want to avoid sort of neck flexion, which can again compress jugular veins. And then if we really do, if the patient has been diagnosed with increased intracranial pressure, we try to want to, usually these patients at this point are in an emergency setting or in an ICU. And we really try to be honest, minimize contact with the patient, to sort of bundle your activities and plan your innovations, because we really want these patients to rest, to sort of maintain a calm environment. In many cases, we actually purposely sedate the patient and may or may not actually intubate them and put them on a ventilator, particularly if you're worried about area and pressure on the brain, on the respiratory center of the brain. Similarly, again, thinking about a sort of an ICU or a very advanced care setting, you want to maintain a normal body temperature because fever can increase cerebral blood flow, and we really don't want any more pressure in the brain than we need to. So you might use cooling blankets, you might adjust the room temperatures. Same thing with blood pressure. You sort of want to maintain sort of a normal blood pressure. Again, hypertension increases blood flow to the brain. We're going to be doing strict I's and O's. Most of these patients, again, because of the potential for seizures, if they don't already have a seizure history, we're going to be worried about seizure precautions. And then in rare cases, again, depending on the cause of why the pressure is increased, the patient might be offered chemotherapy, either given into the brain via a catheter, because remember, most chemo drugs don't cross the blood-brain barrier. Very rarely, very, very rarely, a patient might get radiation, but radiation tends to cause swelling and edema. And again, we're trying to keep the swelling in the brain down. So those are some of the treatment interventions that might be done, and certainly the nurse is involved with.
So, Mary Elizabeth, what are some of the surgical considerations for these patients?
Great, yes. So when I had just mentioned the chemo and the radiation, they're actually more in rare circumstances. Certainly, there are surgical considerations that are more likely to be considered in patients with increased intracranial pressure. And the first, and probably what most people have, is a placement of a catheter, usually an external catheter to monitor the pressure. We monitor the intracranial pressure. You want the normal pressure is sort of between 5 and 15 millimeters of mercury, and we want to try to keep it less than 20 or 22. We also, in an ICU setting, may monitor cerebral perfusion pressure. We may put a drain or a shunt in to drain cerebral spinal fluid if needed. Again, we're kind of treating the etiology. So if the cause of the increased intracranial pressure is a brain tumor or a brain bleed, a hemorrhage in there, you might have surgical resection of that. And then in very severe cases, there's a procedure called a decompressive craniotomy, where they actually go in and take a piece of the skull out, basically to allow the brain to swell a little. And then when the patient is better and the brain swelling is down, they actually reinsert that piece of the skull. So again, that would be where none of these other interventions worked. They may just allow the brain to swell. But again, remember, because your cranium is so fixed, they open up a piece of bone to let that happen.
I would think that, all of these interventions that you have just mentioned are things that would have to happen really quickly with these patient populations.
Yes. And again, depending on, as I sort of mentioned, we sort of need to treat the etiology and sort of figure out why this is happening. And that sort of really guides the treatment.
Exactly. So are there pharmaceutical considerations when we're talking about management of increased intracranial pressure?
Well, there certainly are some medications that the nurse will be administering, and probably the most common are diuretics, mannitol particularly. The idea, again, is to decrease fluid, so you want to diurese the patient. We use hypertonic saline. And then thinking about some of those other nursing assessments and interventions we would want to do, we would likely also be making sure if their temperature was down. So you might be giving acetaminophen to reduce their fever. If their blood pressure was elevated, we might be giving blood pressure meds. Most likely we'll be giving prophylactic seizure meds. And then again, maybe anti-nausea meds, sedation, really medications to keep the patient calm and keep their, everything sort of calm.
Now that we've talked a lot about how this happens and interventions and things for the nurse to think about for assessment, are there any age-specific considerations with a patient that may have increased intracranial pressure?
I don't think there are any specific age-related considerations. We know children can certainly get increased intracranial pressure. Again, we're talking in this format, we're talking about cancer. But if you remember, sort of in the general population, the biggest etiology related to increased intracranial pressure is brain injury. So, kids that are in car accidents, adults that are in car accidents, sort of those kind of injuries are much more common than this in cancer patients. But for children, I think the idea is to look again, depending on what age they are. If they're very young, they remember those fontanelles that are sort of opened up before your skull fuses. If you see bulging out of it, that would be just sort of a different assessment, I suppose, for children. But children with brain tumors, and with hydrocephalus and things like that certainly can get increased intracranial pressure. But to be honest, while the drug doses might be different, the treatment is pretty much the same.
So let's talk about education a little bit. For patients that are at higher risk for developing increased intracranial pressure, what kind of education should the oncology nurse provide to the patients and or caregivers about increased intracranial pressure?
Well, I think really, and I would say this probably is the high point of oncology nursing education, is to explain what they could potentially expect and to be, more importantly, to be on top of the symptoms, particularly, as I've said, unfortunately, quite a few times, a new onset headache, the one that's first in the morning. And really for caregivers, depending on the patient's etiology, if somebody has a brain tumor, they might already have some changes in cognition or consciousness. But really for the caregivers is reporting their change. If it's bothering the caregiver, then it's worth telling the nurse. Any change in their level of consciousness, confusion. Again, if the caregivers are with the patient most. So I think being able to take what they say, realistically. And if they're concerned about it, then I think in most cases we should be concerned about it as well.
Well, Mary Elizabeth, this has been a really interesting interview with you today, and really something that's very important for oncology nurses as we take care of our patients, and really to understand and know what some of those oncologic emergencies are that our patients do or can experience. So as we're wrapping things up today, there are some questions that I always end our podcast with, and I'm going to do those in a real quick fire manner. And the first one is, what are some common misconceptions about increased intracranial pressure?
I think what comes to my mind is that we often don't remember that this is potentially fatal. The severity of increased intracranial pressure, it is an oncologic emergency. And if it was left untreated, it could be fatal.
Okay. What's something about increased intracranial pressure that's not often discussed, but you wish people knew more about?
I think that we're probably likely going to see this condition occur more often. I think as an oncology community, we're getting much better about treating patients' primary cancers. And as cancer therapies improve, we're going to probably be seeing more incidents. And I think the incidents are rising of brain metastases. Patients are living longer, and it's allowing the cancer to spread to the brain. So if we have more brain mets, we have more potential for increased intracranial pressure.
What additional training or education do oncology nurses need to manage patients with increased intracranial pressure?
Well, I think just listening to things like these podcasts is allowing somebody to get additional education. Again, patients that actually have increased intracranial pressure are usually cared for in an intensive care setting. So critical care training for managing these patients is important. But for most nurses, again, knowing what the potential signs and symptoms and knowing who's at increased risk is important.
And finally, what are some additional resources, both for our clinicians that are listening to the podcast today and for patients who want to learn more about increased intracranial pressure?
Well, with along of the Oncology Nursing Society books and resources and things like that, there are two organizations I'll mention. The American Association of Neuroscience Nurses is a wonderful resource, particularly for nurses working in neurology or working in neurocritical care. They have a wonderful set of resources for clinicians. And then there's the American Brain Tumor Foundation, which has both clinician resources, but has a wonderful plethora of resources for families and patients about different types of brain tumors and different conditions that affect the brain.
Thank you. Do you have any final comments for us today, Mary Elizabeth?
Just, I guess, a thank you to you, Stephanie, and for those behind the scenes of this Oncology Nursing Society podcast. It's been a pleasure.
Well, thank you very much for joining me today. It has definitely been a pleasure, and I think this will be a very valuable podcast for our listeners who tune in to us. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.